I woke up in the morning, had a coffee, and I'm kind of a news guy. I like to watch the news in the morning, so turned television on. About 5 minutes into it, I felt a sharp pain across my shoulder blades. It was very painful, and I thought, there's something wrong here. So I got to my cell phone, called 911, and I made 2 more phone calls, one to my neighbor and one to Dr. Taylor.
When he spoke to me, instead of the usual positive, "How you doing, Brian?" it was, "Brian, it's Rob. I think I'm having a heart attack. Can you come over?" I thought, if Rob thinks he's having a heart attack, he's probably having a lot of pain, because it takes a lot to knock this guy back.
Brian came over right away, and I can remember him checking my pulse, and just the look on his face, it didn't seem to be very good news what was going on. EMS came. They thought I was having a heart attack. He thought it was something else.
I'm not a cardiologist, I'm a surgeon, but we're all trained in the rudiments of heart ECG diagnosis. And to me, it didn't really look like he was having a heart attack, but I said, "You need to get him out of here quickly." Rob's a tough guy, but he looked so in shock at this point in time that I was wondering if he was going to make it all the way to Lion's Head. And I thought, geez, I don't want to lose that guy. He's a good friend and a good neighbor.
I can remember going in and out and hearing loud noises. I went in and out of that for, it seemed like forever. Just fighting and fighting and fighting and fighting to make sure I was going to wake up.
I kind of lay awake that night wondering what was going on. And then Rob Jr. called me and said, "Well, they found something. They're airlifting him to Kitchener."
St. Mary's was founded by the Sisters of St. Joseph of Hamilton in 1924 to meet the healthcare needs in the Kitchener-Waterloo area. The sisters felt and displayed a sense of joy and hope as they responded to a need in the community. People are St. Mary's most important resource. Their caring, skills, and insistence on excellence enable them to carry on the ministry, faithful to their traditions and responsive to the community they serve. St. Mary's continues to explore innovative ways to deliver health care while maintaining its traditional mission values.
Patients will often say, the way St. Mary's made me feel. St. Mary's made them feel cared for. St. Mary's made them feel safe. And that's what defines us. And that's what's defined us for the last 100 years.
St. Mary's General Hospital opened on October 21st, 1924. It was commissioned by the Bishop of the Hamilton Diocese to the Sisters of St. Joseph's. It was at the edge of town. I mean, really, there was a dirt road coming up Queen Street to St. Mary's. I think everybody thought it was unique because it lived on an island and the dirt road went around.
I've heard stories of how the sisters, went down into downtown Kitchener and they brought folks that needed care. And at that time, King Street seemed like it was an hour away from the hospital, and they walked down and they brought folks back, and that's how things got started here. And I think it's always just been who we are. It's in our DNA.
Just the blanket warmer. We keep our blankets warmed in here for our patients. That's probably, in my mind, one of the best things we do for our patients is give them a warm blanket. I started here in 1963. I walked through the staff door just down the hallway, never thinking that I would be here 60 years later. It was not my plan. Somebody will tell me someday when I'm physically or mentally not able to do this anymore. But until that time, I'll keep at it.
Just concentrate on your breathing. In through your nose, out through your mouth. It's interesting developing a relationship with a patient. Every patient has a physical side and they also have an emotional side. So it's fun when we have time, which doesn't often happen, but it's nice when we get to know them.
Age is just a number.
Yeah,
Health is everything.
It is, you're right.
There's no room for being fake in this place. People are hurting, they're in pain, they're uncomfortable, they're exhausted. All they know is they were told this crazy name of a procedure. They don't know what it means. And then all of a sudden we're there to take them down. As soon as you feel that chair on the back of your legs, I'll have you sit. You know, I do kind of have to gauge where a patient's at. If I go in to see them and they're giving me a good like, oh, hello, then I know, okay, we're gonna have a good time. So I really just try to reflect whatever that patient needs, whether it's someone to joke with, whether it's someone to complain to.
I had 8 surgeons waiting for me, and they opened me up, and they found not only did I have a bleed, I needed 3 triple talk bypass, 8 hours of surgery.
But on the road to recovery,
Yeah, on the road to recovery.
You build bonds with these patients. And I didn't expect that because sometimes we're only with a patient for 5 minutes, truly just as long as it takes to get them out of their room, down the elevator, and deliver them to the test.
You're awesome, honey. Honest to God, the world's better for you.
And yet the stories, the relationships you build are really incredible.
This is the wall, and I joke that maybe my picture's going to be here someday. These people have all passed on, and they all used to work here. Someone would say to me, you must have heard every story in the book because I've been here so long. And no, I haven't, because every day I hear something new. It never gets boring. It's just helping people, helping them through probably some of the worst times of their life. If I can help out and relieve some suffering, smile, have a laugh, that's what brings me back.
Code 20. Everybody okay? All right. 1, 2, 3. I think that's fine. Thank you, guys.
Who we are and how we care for patients and their families is the St. Mary's Way. And I think that foundation was laid by the sisters when they came and they selflessly gave of themselves. And we've just continued to adopt that. That's really, again, it's what we do. It's what we should be doing.
St. Mary's has continued to progress as healthcare needs of the community have changed. The aim has remained constant to maintain a healthcare where healing of both body and mind could be achieved effectively and comfortably.
I was a manager at the time, so the management group was called in and told by the board chair and by the president, CEO at the time, that this hospital would be closing. I felt shock, denial, disappointment, and a strong sense of how could this be happening? Why is the decision being made?
I'm sure we were all concerned about our jobs, you know, where would we be going and how could we manage with one emergency department or one hospital in the city.
We fought hard to save St. Mary's because St. Mary's was, you know, near and dear to many people's hearts, and the signs were out all over.
There was quite quickly a huge outcry from the community. There was petitions, and there was marches, and there was rallies, and there was buses went to Queen's Park. St. Mary's again, because it's one of those unique places, they weren't going to give up.
Like everything starts with a business case, or it starts with a problem, and then you come up with a solution. And they really had a solution to a problem that we had in this region, and that was no access to cardiac care. You know, all of the orthopedic surgeries, for example, going to Grand River, and labor and delivery going to Grand River, and they were starting to rationalize things. And it sort of looked at the end of the day and said, well, if we did that, what would St. Mary's be known for? What would we be doing? So we became a cardiac center. We also became a center in chest. And then, of course, we're now recognized as the regional eye center as well. It was an exercise in efficiency that at the end of the day, we were able to put a case forward that was based on sound evidence and access to care, particularly in cardiac services. And that's how St. Mary's became a cardiac center. Think about St. Mary's as being the place where your heart gets cared for. How perfect is that?
Hey, Carol, this will sting a little bit, just some free.
When I went into medicine, I knew I wanted to be a surgeon, to do procedures. When I was trying to select a surgical specialty, I then realized I wanted a specialty that has to do with quality of life. So that's how I kind of gravitated towards vision care.
When I was in high school, I decided that I was really interested in heart transplantation. When I got to medical school, I learned about all the other kinds of surgeries, bypass surgery, valve surgery, aortic surgery. I love the technical skill that's involved in cardiac surgery, and then seeing how patients do afterwards.
In medical school, I tried a lot of things. I didn't really have a clear direction. In the end, I decided on thoracic surgery more because of the patient population. There's a human aspect to it more so than a lot of other surgical specialties.
In medical school, I was drawn to cardiology. It's one of the most important organs in the body. It doesn't work, the patient's not alive anymore. I wanted to go to a place to explore. We went to a number of different places, from Calgary to St. John's, exploring communities, exploring hospitals. But as we explored, there was really no other place like St. Mary's, like Kitchener-Waterloo. Lights down, please.
For about a year, I was dealing with blurry eyes, but they started to get really bad. By the time I got to go see the eye doctor, I could barely see out of this eye. It was difficult, taking care of 2 kids and pets. That was scary, and it was emotional.
For patients like Toma, the cataract developed very rapidly. And as a result, she had a quick decline in her quality of life within a very short period of time. Being able to treat that cataract promptly and restore her sight promptly meant a lot to her, not just for her quality of life, her mood, but also for safety.
After a year and a half, almost 2 years of not being able to see, I can see perfectly.
Being able to restore sight for my patients, it's a really rewarding experience.
Every step along the way, everybody we work with, they have that can-do attitude. That's where that phrase, nothing is impossible, came from. Because if we have an idea, the first answer is, yes, let's do it. Let's figure out how to get it done. Let's figure out how to afford it. Let's figure out how much time we need to do it. It's really an exciting time to be at St. Mary's. It's an exciting time to be in cardiology. We have new ways to do things, and we have the enthusiasm of the team, of the hospital, of the administration to use those so that our patients do well.
When you get a cancer diagnosis, as I say to people, you now cross a line and you lived in a BC, the before cancer world, and now you live in the AC, the after cancer world. And I was sorry I had to take my family along with me on that road, especially in that moment, because I hadn't come to any terms with it. I never smoked a day in my life. How do I end up with lung cancer? My older son, who was back at med school, called me later that day to see what happened. I'm like, I don't know much, but I don't think lung cancer, I don't think that's a good thing in the cancer realm of things. And he said 80% of folks diagnosed with lung cancer will not see 5 years, but Mom, you're gonna be the 20%.
Michelle came to me and, we went through the standard, workup and whatnot. And
I said, so what happens? He said, we're gonna take your whole top, you're gonna take a whole lobe out. But we are doing a new protocol with something called ERAS.
As it turned out, she was one of our first ERAS patients, so enhanced recovery after surgery. There's a number of things that we talk about in ERAS. So one, before surgery, we talk about prehabilitation. I always joked with my patients, say, just pretend you're getting ready for the Super Bowl and this is your training. After surgery, the minute patients were awake enough in the recovery room, they would have their family come in and they would walk around the recovery room that quickly after lung surgery.
The whole thing was get on your feet, stay doing exercise before you go, and as soon as you can after, you're gonna be exercising. It sounded revolutionary.
Before that, we used to, the patients would be very anesthetized. They'd take a long time to come out of anesthesia. We wouldn't make them move until the next day. All of a sudden, our mortality rates were cut in half and our lengths of stays just cut into a quarter of what they were. So it was absolutely astounding. It was such a paradigm shift that everybody was like, no, this doesn't sound right. Like, how can you possibly do that? But, that happens with so many things in life, right? You have to think there's a different way to do this. Just because we've been doing something some way for years and years and years doesn't mean that's the best way.
One of the physicians in Owen Sound called us about him. He had actually been there for a couple of days, I believe. They did a number of investigations to try and figure out what was going on. And on his initial imaging, it was a bit unclear. And then he had a transesophageal echocardiogram. On that, they saw that there was fluid around his heart, and they highly suspected what's called an aortic dissection. When people have an aortic dissection, 50% of people won't make it through the next 24 hours. And every hour that passes without having an operation, the risk of dying is 1% to 2%. So that increases quite quickly. So with all of that in mind, we made the decision that he needed to come immediately, be airlifted here, and then take him for surgery right away.
I don't remember anything from the last CT scan to waking up just before landing in the helicopter. They told me I was in Kitchener and going to St. Mary's Hospital. A totally different thought went through my head then, knowing that something serious has really happened.
Mr. Freestone actually had a significant complication. The main thing we worry about is the aorta actually rupturing. For him, his aorta had ruptured and blood was leaking outside of his aorta, pushing on his heart, and is basically what caused him to be in shock. If we didn't take him for an operation, he certainly wouldn't have survived.
And then I woke up. Dr. Higgins came in to see me. At what point, I don't know. I remember saying this, and that was, so how was I when you got me? And she said I was pretty much dead. Which, yeah.
He was so grateful to be alive, and all the stuff he had attached to him was just, whatever. He said, doesn't matter. I know I'm going to be okay. Remarkable.
I try and think of what I do as a service to patients. As surgeons, we want to be just operating all the time and, less interested in doing office work and following up with patients. But those office days can actually be quite rewarding when you have a day where basically people are coming back and telling you the difference that you've made in their lives. And a lot of people have this psychological change afterwards where now they don't want to take things for granted. They're going to, make the most of all the time that they have.
And when you have a day like that, it really reinforces that those hard days were worth it. Because now, even though that patient took a long time, was more difficult, was more complicated, required an extra pair of hands from a friend or a colleague, now they're doing so well. And that's really at the end of the day why we do what we do.
We follow patients for 5 years after lung surgery. Hopefully they make it to 5. I think that gives you that extra connection with your patients. And so when you do something for somebody, when you know a little bit about them, it's even that much more rewarding.
When you hit that 5-year mark, you go for your last CT. And when I went in to see him, he said, "This is it, Michelle, that was the last one. I'm done with you and you're cured." And I was like, I'm cured? And he said, "You are cured. You have hit the 5-year mark. That cancer, it's gone." That moment was actually quite unbelievable. I just remembered the 20/80. And when I called my son, he's like, "Told you, Mom. Told you you're going to be the 20%.
To see the relief on people's faces and the appreciation for what you've done for them, it's the best thing ever. Congratulations. You're at the end of a long road, and I was there with you the whole time.
As St. Mary's Hospital celebrates many years of caring, Let us remember the visionary founders and the people that have made the hospital a leader in healthcare in our community.
St. Mary's didn't start 10 years ago or 20 years ago. It started 100 years ago. And I think it serves us well to remember that it was built on a lot of hard work and dedicated people.
When your foundation comes from a group of women, a group of nuns, and they're all about the care. When you have that kind of foundation and you have leadership that fosters that sticks along generation after generation.
Over its lifespan, it has risen to the needs of this community. And when it was opened originally and it was taking in anyone and everyone that needed support, and then it became a general hospital and it was doing everything and anything our community needed. And then when it reinvented itself and became a cardiac center, it's what this community needed. I've been doing this for 19 years and I still get goosebumps when someone says, St. Mary saved my life. I never stop being in awe of what this place does.
Currently, as we all know, there's a plan to have the two hospitals share one site and build a new hospital. Maybe they'll take some bricks and put them in the new foundation or something. But I think more importantly is the staff that work here and the enthusiasm and the passion, the care that they provide. You're not going to lose that just because you move to a different building. The core of that caring is going to go with the staff to that new building. I'm convinced of it.